Around the world, there are 300 plus million people just with diabetes. We often see patients who succumb to wound infection because that enemy, that bacterial load, is very difficult to track. Healing wounds faster and better remains probably one of the most important battles that clinicians face. In fact, globally, wound care has been declared as the silent epidemic. Clinicians still can't see bacteria. MolecuLight's technology makes that invisible enemy visible.
It's a very simple camera that you can take a picture and document the wound, and then you turn off the lights in the room, turn on the fluorescence, and you can see right away where there's fluorescence coming off that wound. The major benefits of the MolecuLight camera is that first it photographs the wound, so you have documentation of the wound. Secondly, you identify the bacteria, you identify where the bacteria is, and you start treatment early. You have a wound, and around the periphery of the wound, you may see that there's a staph infection, and in the center of the wound, there's a Pseudomonas infection. If I was just to take a swab, which I did before this camera was invented, I'd probably stick a swab right in the middle of that wound, get a swab that was positive for Pseudomonas, but missing the Staph aureus around the periphery. We'll also take another picture after debriding and see if it's a slightly different picture. The role of imaging in wound care is critical. It's essential that these wounds be documented, and the imaging can actually help diagnose what's going on with the wound, and it's a way of documenting progression of the wound. If anyone can use an iPod, they can use this device. If you're involved in wound care, this is an essential tool.